Hello and welcome back to the Advancing Health Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. We're super excited to have you here. So, we're having some incredible conversations with real leaders that are painstakingly reshaping the future of health. And we're really passionate about a few different areas. We're passionate about access, we're passionate about innovation, leadership, and adoption of those innovations. And if it's your first time tuning in, let me just sort of take a quick step back and tell you just a little bit more about what we're trying to do here. So, our focus is on bringing real stories of innovation to life. Not just things that you're reading, but actually real people that are really doing some incredible things and giving them the opportunity to share their stories, their wins, their learnings with our community and ultimately with the world. So we've got an action-packed year of just incredible guests. If you haven't checked out any of our historical interviews, wherever you are, if you're watching this, if you're listening to this, wherever you are, just hit the subscribe button now so that any of the new interviews come directly to you. So today's guest is actually one of those rare people who doesn't just see where the world is going, he builds the rails for the rest of us to actually get there. So Aber Whitcomb is the CEO of Salt AI, but most people in tech know him for something a little wild. He co-founded MySpace. He helped architect one of the largest social platforms on the planet during a time when no one actually had that playbook. And instead of coasting on that legacy, he went right back into the arena. So Salt AI is his latest chapter. You're taking one of the most painful problems in healthcare and turning it into something that actually works. Real-time intelligence, precision matching, a level of speed that health systems and pharma companies and all the likes are using, but they desperately, desperately need it. And Aber is doing some of this with a very similar mixture of curiosities, engineering rigor, and just sort of a calm focus and intensity that's made him one of the most respected CTOs of this generation. But what really stands out to me is Aber's not trying to build the loudest company. He's actually trying to build the most useful one. And in a moment now where healthcare, there's just a lot of noise, drowning in hype of AI. And I think people are actually really starving for substance, and that matters. So we're going to kind of go into his journey, what he's learned about building things at massive scale, how he thinks about product velocity, why he jumped into healthcare and, what he's seeing across the ecosystem and what he believes AI can actually create lift instead of actual noise. And yes, we're absolutely going to talk about MySpace. How can we not? So let's jump into it. Aber, great to see you. Welcome to the show.
Good to see you, Michael. Great to be on. Thanks for having
Yeah,
me.
man. Of course. So before, big companies and big stages, there was just Aber. When you kind of look back, what were some of your like early clues that you were kind of wired to think about problems differently? T Talk about some of that from your like sort of strategic pattern recognition. I'd love to kind of get into your mind and how you see and look at big problems.
Yeah, it's interesting. I think at my age, I was one of the last generations to go through school without cell phones. So
Yep.
and
Yeah.
really, when I was in high school, that's when PCs were really starting to become a thing. Windows was blowing up and
Mhm.
broad distribution of PCs. So I think I was lucky in the sense that I was able to get a computer probably when I was a sophomore in high school, and I was
Yeah.
dialing up, into AOL for internet connectivity, and
Yeah.
it just fascinated me early on that you could communicate with other people in this way. Before that, the most amount of technology that I had was like a Nintendo, you know.
Wow. Yeah, I'm right there with you. I remember just being able to dial up on America Online. It's just a very, very vivid picture of that
Yeah.
being on Instant Messenger. It's just it's wild. I'm
And
looking
yeah,
at
and it was a pretty simple life before that, I mean, there wasn't a lot of technology to engage with, but once it came, then I was just hooked, and at that point, when I decided to go to university, it was pretty obvious to me to study computer science because that's
yeah.
what that's where my interest was captive. So,
Mm. Now, look, having kind of done what you've done, I'm imagining that there are some environments that were pretty intense, over the years. What's like a story from those early days that kind of taught you about pressure and dealing with pressure that you still kind of carry with you like now?
oh man. Well, if we jump ahead to the MySpace days, we started MySpace in 2003. And
Hmm.
in those days, that was pretty much before open source was even really a big thing. And
Yeah,
so, the framework for building large scale infrastructure just didn't really exist. There was a
yeah,
handful of
yeah.
companies that had some technology that was mainly built in-house, you know, and so when we started MySpace, it was just we had to do everything ourselves, including hosting
Hmm.
your own infrastructure, right? So I had to have data centers all over the country. So not only are you building software that, at a global scale, but you also need to manage all of your servers. And I remember being, sitting at my desk at MySpace and some massive array of disks just completely fails, and
Oof.
you're sitting there like, what do I do? Everyone's looking at me, I to try to figure this out. Otherwise, we're down, and the business is
Yeah,
gone if I don't figure
yeah.
this out. So obviously, that's a huge amount of pressure, and there's nothing you can do except get up, get in your car, and drive down to the data center and start figuring out what's going on, calling all the experts that I know, replacing hardware to try to get the site back on. And that happened dozens of times at MySpace, and I guess it's a tale of how things have changed so much because these days you just use the public cloud. You have to architect
Yeah,
things
yeah.
properly, but you don't have that problem. If something fails, you spin up a new uh, EC2 machine on Amazon and you don't even think about it.
Wow. So do you kind of have like now, is that sort of etched into your mind? I'm just thinking about the behind the scenes story of that. Like,
It's it's serious
it's,
trauma. Yeah, I mean that's trauma that
yeah, it's
sticks
like
with you for
PTSD,
a long
man.
time. Yeah, and it's even happened to me like when I was maybe out on a date, with a girl and my phone's blowing up that the site's down and I had to leave and go maybe drive down to the data center again. So yeah, I got used to that pressure. I got used to effectively being on call and my baby being, keeping the site up and keeping, that kind of 24/7 consistency for all of our users.
Mm. I'm curious when MySpace started growing I mean, it was a rocket ship, right? Like at a pace that no one had ever seen. What did that uh, feel like for you, on the inside? What was like the day-to-day energy of running and being in that kind of a fast-paced environment like?
Yeah, it's tough. It's only for certain types of people. I think MySpace was probably the first internet property that had nonlinear growth. And so it was unheard of that you not only would grow in a straight line, but that straight line would get getting steeper and steeper and steeper every day. So uh, any type of projections that we were making, we would try to, maybe start with a straight line or maybe start with some type of, parabola that would grow, but we underestimated every time because you just that virality is so powerful, right? You've got the next
Yeah,
layer of people that are then inviting a bigger layer of people, and so yeah, it's an insane amount of pressure. I mean that I look back on those days fondly because everyone had to work together perfectly, and if we weren't working all the time, and passionate about what we were doing, it
Yeah.
just wouldn't have worked. Um, I mean, luckily it was easy to be passionate about it because nobody had ever done anything like this before or seen anything grow to this scale, and you could
Yeah.
really tell that you were making an impact on the world by building something like this.
Yeah, I mean, literally, you were like, I'm just looking at it from a user standpoint. It's like I was watching, seeing this unfold, and I'm like, dude, the world is fundamentally different, and it's like watching it in real time. It was pretty gnarly.
Yeah, it really was. And yeah, and it was all over the news. I mean, I could go into a coffee shop just to order a cup of coffee, and there'd be a guy sitting down browsing MySpace. And when you start seeing that out in the wild, something special is happening there.
Yeah. So I mean, if you had to go back and sort of maybe even just sort of teach a class on building for scale, before you're ready, what's like the first thing you'd tell everyone in the room?
Yeah, I mean, if you're building something for scale, you have to think beyond the number of users that you have today, obviously, and
Yeah.
and what you think is going to be in a year. You have to think in terms of compute units and unit economics, right?
Mm,
If I this amount of resources for this amount of users, and that has to scale horizontally forever. And you can you can build a product very, very quickly these days, but to
mhm.
architect something that actually scales is probably 10x the time, right? And so a lot of that work
Right.
is under the hood, and it's you don't get a lot of recognition for it too. People see what they see on the front end, but most of the intellectual property is actually on down below the waterline. It's like you see a nice pretty duck floating above the waterline, and then you look
Right.
under, and they're just paddling as
Yeah.
hard as they can under there. That's kind
Yeah.
of what it's like.
Yeah. And I'm just sort of thinking because you've built in a number of different industries. What gravitated you towards healthcare? To me, it might be, the toughest arena of all, but I'm just sort of curious what
Yeah,
made
I
you
mean,
want to kind of get
yeah,
into
starting
that?
with what you said, I like challenges, and I do think this is one of the toughest industries to break into,
Yeah.
but it's one of the most important, right?
Yeah.
This impacts our health, and I think if you ask anyone that's thinking rationally what their number one priority is probably it should be their health, right? I mean, so.
Absolutely.
And because if you don't have your health, you can't take care of your family, you can't make money, you can't do whatever you need to do. So I like that challenge. I
Mm,
also see what is happening with AI. So AI is being built by hardcore engineers, people that code, and so naturally a lot of that work is going into things like coding, right? Like
yeah.
like let's
Yeah.
build a model that's really good at coding because that's what these engineers know.
Mhm.
And so that makes sense, and an incredible use case. But healthcare and life sciences is a tick behind that innovation. They're not
Mhm.
benefiting as much from that. So I believe that bringing some of this really hardcore AI engineering into healthcare and life sciences is going to make a huge impact on the
Mm,
space.
mm.
Um, and I've had the benefit of working with like Dr. Agus at the Ellison Medical Institute, and he's taught me a lot about oncology and healthcare, and we're working closely with them on a prostate cancer therapy. So, having kind of mentors like that help me break into this space has um, gotten us a lot further.
Yeah, the relationships matter. Healthcare is definitely a relationship sport. It's
Hmm.
when I don't even want to say outsiders, but when you have folks that aren't native to healthcare, they don't know the environment as well. they're viewed fundamentally differently. But when you have someone that can lend their credibility, their reputation, like, hey, and bring you into those types of conversations, it changes the trajectory. I'm just sort of curious, you having come from big tech, what was the moment where you said, okay, you know, healthcare works very differently than I expected?
Yeah. So I had a very big culture shock when we started bringing our technology into pharma, and these are, top
Yeah,
20
yeah,
pharma companies, and they're very much interested. They like the technology and they want to move forward. So once you start moving forward with them, you realize that, wow, this sales cycle could actually take a year,
yeah.
and I'm not used to moving at that pace. I'm an
What's your
entrepreneur.
no, what's your norm? What's your norm? You're like, all right, let's move fast. Like, what's breakneck speed for you?
Well, I mean, I like to make progress every single day, and I would it's like, okay, you like it, then let's buy it. Let's close the deal right now. You know. So that they didn't need a lot of time to get used to something. But if you look at this industry, there's a lot of compliance involved. There's a lot of bureaucracy involved. They're making an incredible amount of money, so they have more to lose and more to protect. Um, and that's also why what also motivates me too is because I think if we can crack this industry
Yeah.
and make kind of a meaningful impact on it, I think then we can say, okay, we've solved these problems for one of the hardest industries. Maybe let's start moving into some other industries as well.
Mm,
And so we're starting to think about that.
nice. So because for most that are listening to this, maybe this might be the first time that they've heard about salt. What is sort of the main core problem that you're solving that keeps many of these uh, either care delivery leaders and or life sciences leaders up at night?
Yeah. So Salt is you can think of it as a kind of complete AI operating system for the enterprise. And what that means is we can connect securely to many data sources within an organization. And
Mm,
these types of pharma companies, for example, they have huge amounts of proprietary data, and
yes.
they want to connect that data to models. And we provide the framework for doing that in this visual first environment, but also providing full access to the code and the infrastructure. And because of that kind of information security requirement, you have to architect a product like Salt a little differently. It's
Mm,
not necessarily a SaaS tool. What we need to do is we need to install Salt deep within their infrastructure to get close to the data and make sure that that data is not leaving their firewall and can
mm,
connect to many kind of life science based models, not just
right.
LLMs, but many models that have been trained on evolution and biology. Um, and so providing that kind of very secure infrastructure for the enterprise is really what Salt is about.
Mm. And you're known for like product velocity. What does that look like inside of Salt? I mean, how do you build a culture that can ship a product fast without breaking trust, given that in healthcare, trust is a really, really big thing.
Yeah, absolutely. I think one of the advantages that I have being around for so long is that I can put together a team of people that I've worked with before. And I
Yeah.
can cherry pick all the best people from my past, and that's really what we've done at Salt is built that team of A-list engineers and go-to-market specialists So that's really where it starts, right? Having the best team, because if you're developing this type of software for something that's so important, it's got to be good. It just,
Mm,
it has to be done by experienced engineers. That doesn't mean you can't move fast. You can still move fast. It just has to be very quality code. And we use a lot of AI tools to ensure that.
yeah,
I mean,
yeah,
we're not using AI to write all of our code, but you can use
right,
AI to write a lot things like testing harnesses and unit tests and make
yeah,
sure that the quality is extremely high. And so
yeah.
when we go and install, we can have confidence that things are working as
Mm.
expected. But that being
Because you,
said, that being said, it's also pretty high touch, right? When we've got forward deployed engineers, well, we'll
yeah,
send engineers on site if we have to make sure that it works.
yeah, because I'm just thinking like, you've coached, you've mentored a lot of brilliant engineers. Um, I'm just thinking what's the difference between someone who's like really good versus someone who's like, man, this person is special.
Yeah, I mean, have you heard about the 10Xer? Like they're like these unicorn engineers that somehow have the ability to get done. They literally do 10 times more work than your average engineer, and they're very hard to find. They're not always motivated by money. They're motivated by solving extremely tough problems, and it's just another gear that some people have to not only be creative with what they're doing, but also when something's done, it actually works as expected. And I just I try to amass as many of those types of people as possible without compromising and saying, oh, well, we need some engineers. We're just going to hire these guys right here.
Right, right,
That's
right.
not how it works. So, you really have
Yeah,
to find that type of talent.
yeah. And when you sort of zoom out, and look beyond the curve, I'm just going to pick 5 years out. What does success look like for Salt? And not like, what you're telling your investors, but like the actual leader, the human version of the purpose of what you're building. What does that look like?
Yeah, I mean, the use cases for our customers, which are things like discovering de novo molecules, proteins that have never been seen before
Yeah.
in nature. Um, use cases on maybe creating a cancer therapy. My goal is to make them successful at what they do and
Mm.
compress these timelines that have become the norm and create a new norm, which might be 10 times faster with the ultimate goal of curing disease, I think is that's the trajectory that we're on right now.
Yeah, that's the bet that you're making in my mind. It's like, hey, we feel like we can cure these diseases better, faster, more efficiently with a higher degree of precision using our technology. Like that's
That's right.
fundamentally when in the research I was like, man, this is game changing. Are there any points of frustration where you see it so clearly and yet maybe you're around others that are in the industry that don't see the vision that you see? How do you sort of deal with that, just knowing that you can see so far ahead and others they're just not there yet?
Yeah, there's skeptics, and there's people that have been designing proteins for 30 years, for example, and they see something that comes out of AI and they say, well, that's never going to work. Um, which is great. I think that helps. You need those types of people and that
Yeah.
constantly kind of maybe raise the bar and move the requirements higher and higher. So it doesn't really frustrate me. I
Mm.
embrace that type of doubt. I don't know exactly what's going to happen with AI. Nobody does. But I'm very confident that this is a powerful technology that is changing the paradigm here.
Yeah, yeah. I mean, I'm just sort of curious, what is that sort of a hill you're willing to die on when it comes to AI? Like, hey, that like no one knows what's going to happen in the future. and we're just kind of we're riding the wave just like everyone else is.
Yeah, I think the AI singularity is real, and it is very difficult to predict what's going to happen. I mean, I'm surprised every day about what's happening. I mean, we're now talking about data centers in space, which I don't think anyone would have even predicted like a year ago, right?
Yeah,
And
yeah, no, for sure.
so it's I'm excited about it, and I'm really embracing it. And I like to live in the present as much as possible, or in the near future. It's very clear to us what we need to build and build quickly.
Mm.
And then we'll take the next phase and the next phase from there. But I think making long range predictions is difficult right now.
Yeah. When you think about the level of access that you have now, seeing kind of behind the curtain, especially on the life sciences, even on the care delivery side, is there something that sticks out in your mind that you feel like this should absolutely never be automated? What is that one thing?
I think uh, drugs are a slippery slope, right? I
Mm,
think you can kind of see this future where AI can create some type of compound so quickly that could maybe even be customized for every individual. And in that case, you might not need to even go through the FDA, right? Somebody can take
right.
whatever they
Yeah.
want personally. So I think that's a pretty interesting dilemma, where AI is so powerful that it can create almost any drug and can make, pills and therapy almost ubiquitous for everyone. I don't know. It seems like it could be a good thing, but it could be a bad thing in the future too.
Yeah. 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 Even just thinking about how there are other innovators that are out there, I guess, is there sort of a message for those that are tuning in that maybe they can take with them as they're also trying to build something that matters? Is there a message that you want to share with them?
Yeah, I mean, I think believing in your vision, there's going to be times where you doubt your vision and maybe are ready to give up. So when you're in that state, know that that's completely normal.
Yeah.
And the people that win are the people that break through negative thoughts like that, or when it feels like everything's against you.
Yeah, absolutely. Before we wrap, I want to make sure that you at least kind of give like a commercial segment. Where can people go to follow all the work around Salt? And if there's anything new that's coming out that you kind of want to maybe broadcast and share, like the floor is yours.
Yeah, thank you. Yeah, if you go to salt.ai, you can take a look at everything that we're doing. You can book a demo directly from the website, and we'd be happy to show you Salt. Um, we're we'll be coming out with something called Salt OS, which will be
Yes.
kind of that complete operating system that I was talking about, and
Yeah.
maybe a little bit more self-service, right? Where right today when we engage with big companies, and we make sure that they're successful with a lot of effort. But our product
Hmm.
is getting good enough to where I think we can have more people actively engaging in it.
That's really, really exciting. When you say more people actively engaging in it, are you thinking smaller enterprises? Are you
Yeah.
thinking like physician practices? Like how small are you thinking, or what kind
Really,
of scale are you thinking
any
about?
size, anyone that values their data, their proprietary data, and wants to enable AI for themselves, right? And that's really the principle that we have. If you've got some information that powers your business, you probably shouldn't be sharing that with these big model developers, right? You should be owning the solutions yourself,
Yeah,
and that's what Salt does.
amazing. Yeah, this has been a lot of fun. Just even seeing how you think about problems, how you think about pressure, building and scale. When you mentioned about having data centers in space, that was actually the first time that I heard that.
Oh
So
yeah.
I'm kind of like, wow, that's actually really interesting.
It's fascinating. Yeah, and I think Elon has figured it out. So stay tuned.
Yeah.
Yeah.
Yeah, yeah. So I mean, you've built at a level that I think most people never get close to. Um, so it's just sort of really cool to see how you're thinking about how you see the world and how you're approaching things that make it feel like it's actually possible. I just think what you and the team at Salt are doing, it's actually really clever. And for everyone that's tuning in right now, if there's something that are going to take from this, I think it's pay close attention to the problems that actually matter, and move towards work that actually really stretches you. When you spoke about Aber about like, hey, actually cultivate and find like that world class talent, that 10x talent. Think about what that does. Um, and don't underestimate what can happen, when you sort of mix in a bit of curiosity and execution when they come together in the same room, and obviously having the right relationships in the right context, with the right alignment that can create a lot of momentum. So appreciate you bringing your story here and just being very rigorously honest. And for all those that have been tuning in, appreciate you just wanting us to sort of explore and go deeper. So this is a platform that is about community. It's about actually making things happen. So thanks for listening. Keep building with purpose. And we'll see you next time on the next episode of the Advancing Healthcare Innovation Show.